10, still here, that's all me. Black love 2D.
Okay, good afternoon, everyone. My name is Sarah, and I am, my pronouns are she, they, and I am the moderator for this session. And today we have with us Allison Glass from 9 to 5 and the wonderful Allison Kaufman, who you've already seen a lot today and last night. So with that, as always, if you have any questions, feel free to put them in the chat, and I will pass it over to Allison.
Like, which Allison? Okay, I'm going to introduce the other Allison. Allison Glass is joining us today from 9 to 5. Allison is a new-ish Atlantan, transplanted from her hometown of Memphis, where she did statewide advocacy, grassroots organizing, training, development, and facilitation for more than 15 years. She was most recently the state director of sexual health and reproductive freedom.
Hello, everybody. Welcome back. I'm about to be joined by...
One second. I totally have another window open.
If you are in this room...
Okay, it's gone. Most recently, the state director of a sexual health and reproductive freedom coalition in Tennessee, aiming to realize bodily autonomy and reproductive health care for all. Allison is now the policy and training manager with the Georgia chapter of 9 to 5, where she supports 9 to 5's people-centered policy agenda, as well as coordinates and facilitates economic justice and worker rights trainings for staff and community allies. She's also the mother of 3 human beings and 1 dog, and is partnered with a wonderful fellow lifelong seeker of justice. So clearly we have exactly the right person in the room to talk about the intersection of economic justice and reproductive justice with all of us today. Thank you so much, Allison, for joining us.
Thank you so much for having me. I'm super excited to be here and to be a part of this amazing organizing summit in such a critical moment. So I am going to share my screen. I have got a bit of a presentation today, and then we'll be really excited to get to some interactive pieces of our session on the intersections of reproductive justice and economic justice. So let's get this party started. So as Allison said, I am with the Georgia chapter of 9 to 5. 9 to 5 has been around for almost 50 years now. We're going to be celebrating our 50th anniversary next year, which is super exciting. And we are a national organization working for economic security for all women, and particularly women of color. We have been advocating for better worker protections. We've been at the forefront of the fight for harassment and discrimination-free workplaces. And we have chapters across the country, and are really excited here in Georgia that we have organizers across the state in Albany, in Savannah, in Macon, in addition to being here in Atlanta. And we are a member-based organization. We have members across the state of Georgia. So 9 to 5's vision is an economically just world where poverty and discrimination has been eliminated. The contributions of women are recognized and valued, and all women and their families thrive. And of course, our definition, talking about women, I will be talking about women a lot. It is the focal point of our organization for the last 50 years. But of course, we have a gender expansive definition of women and include all women when we're talking about that. So wanted to make that really clear. 9 to 5's mission is to build a movement to achieve economic justice by directly engaging affected women to improve working conditions. So just a little bit of our background. We began as a union for secretary workers in 1973. So if you have seen the movie 9 to 5, you've heard the song 9 to 5 by Dolly Parton, those things are actually based upon our already existing organization. So it literally was a group of office administrators who were being sexually harassed by their bosses. And they got together and said, we have to do something for ourselves because the laws are not there. There are not other mechanisms to support us and protect us. So we need to do it ourselves. And that really is how 9 to 5 was born. So we definitely at that time really were focused on specifically sexual harassment. And since then have definitely expanded our scope because we know that so many different issues impact women in the workplace. So we focus on paid leave, pay equity, housing and utilities justice, affordable and accessible childcare. We do lots of civic engagement work. We know we have to get the right folks in office to move our issues forward. And so that's kind of where we are now. So we have been a part of national movements to pass the Family Medical Leave Act, the Lilly Ledbetter Act, the Pregnancy Fairness Act. Here in Georgia, our chapter was founded in 1980. Of course, I've been a part of lots of different work spanning that time. But more recently, we're really proud to have been one of the leaders of the $15 per hour win for City of Atlanta workers in 2014 through the Living Wage campaign. In 2010, we were a part of the coalition that won the Ban the Box campaign statewide so that workers will not be discriminated against when applying for jobs. 2017, we helped to pass the Family Care Act, which is allowing folks who are already earning sick days at work to use 5 of those days per year to take care of another family member. 2021, we were a part of winning another paid leave law that I'll talk about a bit more shortly, but it is 3 weeks of paid parental leave for state and public school employees. And then last year, we were a part of passing a law to protect workers against retaliation after instances of sexual harassment, again, and that is specific to city and county employees. So just a bit about what we have been up to. And I want to take some time to talk about like what is the status of working women in Georgia now. So in 2019, prior to the pandemic, women made up nearly half of all workers in our state. And mothers specifically were the primary breadwinners or co-breadwinners in 2/3 of Georgia families. So making up a large percentage of workers in our state. Recently, the National Women's Law Center put out a report showing that there are 2 million fewer women in the labor force now since February of 2020. When COVID began. So we know that COVID has had a huge impact on women at work. So why? What happened? Well, anti-Black and anti-women policy choices were put into effect, or more not put into effect in relationship to COVID. So a recently released report from the Urban Institute found that women were 42% more likely to be absent from work without pay compared to men, particularly for reasons due to childcare or personal or family obligations. 82% of childcare absences were assumed by women, and just 24% of those were paid, right? So only 24% of those absences people had paid time off because they did not have the childcare that they needed. At the same time, women represented 65% of the absences for personal and family reasons, of which only 34% were compensated. So what we see is that it really is women who are taking the brunt of those caregiving responsibilities, and such a small percentage of those were compensated. Meanwhile, 66% of Hispanic workers and 57% of Black workers went without pay due to absences related to illness, childcare, or family or personal obligations. So another huge percentage of folks who are having to go without pay to take care of themselves or their families. So what happened to all those workers? Many of them were pushed out of their jobs. Many of them were just forced to have to quit their jobs, right? Because they had to take the time off. They weren't getting paid. And, it was not sustainable, right? So now what we know is that many of those folks are now unemployed or underemployed, meaning that they've only found part-time work despite maybe a desire for full-time employment. We also know that what has happened is workers have really, in a lot of ways, changed their desires around work, right? Wanting maybe safer or more flexible employment following COVID-19. And especially given the heightened public health risks that are still present, right, for those frontline employees, which we know are majority people of color. So a lot of those workers are now actually turning more heavily to self-employment for their primary or secondary means of working, right? So, that has lots of benefits in that people are more in control maybe of their own schedules, which can be really important for families. And there are some concerns, right? Because we know that folks who are independent contractors or gig workers oftentimes do not have access to those really important benefits like unemployment insurance, like paid sick days, like health insurance, or safety protections. And so there's a lot of concern, right, about then what will those workers have access to when they need it when situations like that arise. The other important thing to highlight is this is a graph by one of our amazing organizational partners, GBPI. Definitely want to shout them out for all of their amazing data analysis. And they just came out with a really important report that I would definitely direct folks to. But this graph is showing the underemployment for people in Georgia. Comparing the fourth quarter of 2019 to the first quarter of this year, right, of 2020. So what we can see is that underemployment, again, folks who are not working full-time but maybe would want to be, among Black women has returned to a gap that's more than double their white counterparts. And white women are also experiencing an increase in being underemployed. Although you can see the increase for Black women is much higher. You can also see that increase for Black men. And so what this is showing is that, while I just heard something the other day about, the unemployment rate in Georgia is like the lowest ever, it really depends on who we're talking about. And what's really important about that is that it really signals a rising recovery gap for people in Georgia, right? Signaling that the recovery is not equitable across race and across gender. So what does all this mean in relation to reproductive justice, right? So what we know, right, is that the decision to become a parent is not only a deeply personal choice, but it's also one of the most economically consequential choices of a person's life. Having a child has implications for one's education, your earnings, your economic security, and being able to plan if and when to have a child is really an essential aspect of planning for one's economic security and future. So we know, looking at Sister Song's definition of reproductive justice, the last portion of their definition, right, includes the ability to parent in sustainable communities. So, what's a sustainable community? A community where you can live and thrive and work in a sustainable way, right? So that means adequate wages and being able to support our families and ourselves in a way that folks aren't having to work 2 full-time jobs to afford their rent and their bills. And we know that that is what families are facing right now. So the economic justice piece is absolutely baked in to the overarching concept of reproductive justice. And we'll talk about those connections even more. So the National Partnership for Women and Families estimates that there's 870,900 reproductive age women and people in Georgia who are economically insecure, meaning that they live in a family below 200% of the federal poverty line. So we know that the Georgians who will be most impacted by these abortion bans are the people who are already most economically vulnerable, right? So it's women of color, people who are working, hourly wage workers, who are most often workers without any paid sick leave or paid time off, people who already are having a hard time accessing affordable childcare. So, poor or lower income people constitute 75% of the abortion patient population, according to the Guttmaker Institute. More than half of those people are people of color who are already most impacted by poverty, lack of healthcare access, lack of affordable housing, and experience racism within the healthcare system. So we can see, right, that we are compounding people's the oppressions that they are already experiencing through these abortion bans. So before the Supreme Court legalized abortion in 1973, 5 states and the District of Columbia had already allowed abortion for several years. And this provided researchers kind of a natural opportunity to study the demographics and economic outcomes of people in those states who were able to access abortion compared to others after Roe happened, right? So, and the researchers have really documented really profound impacts. They found that legalizing abortion dramatically reduced the number of people who gave birth and got married as teenagers. Access to abortion also offered a major boost in those people's economic prospects, allowing them to obtain more education, to enter more professional careers, and to avoid poverty. Abortion access provided those same economic advantages to those people's children that they parented later as well. They found that young people who utilized legal abortion to delay an unplanned start to parenthood by just 1 year realized an 11% increase in hourly wages later in their careers. So we have, a mound of data and evidence on the devastating economic impact for families when abortion access is denied. There was a really landmark study called the Turnaway Study that followed women for a decade and found that those denied abortion, and that is what this chart is pointing to, were 4 times as likely to be living in poverty years later. People who are denied abortions are more likely to exit the workforce and raise children in poverty. They're also more likely to rely on underfunded and inadequate safety social services like welfare and Medicaid, right? These programs that we know do not offer people the support that they need. Research from the Boston University showed that unplanned births reduce labor force participation by as much as 25%. The Institute for Women's Policy Research calculates that abortion bans cost state and local economies $105 billion annually due to reduced earnings, increased job turnover, and a necessary time off for women between 15 and 44 years old. So what we know, we're anticipating that 75,000 people who want an abortion but can't get one will end up giving birth in the first year after Roe is overturned. And the important piece to know about that is that those births are predominantly in states with the most draconian post-Roe abortion restrictions, like Georgia. So with very few exceptions, those 22 states rank at the bottom half of states in the most comprehensive support that they provide to children and families. So meaning that, right, we're going to have an influx of children in states that provide the least safety net support to families. So really, really critical. So this Turnaway study, they also found that 40% of women who were seeking abortion said they weren't financially prepared. 29% said they needed to focus on the children they already had. And another 20% said that having a baby would interfere with their own future opportunities. And another 12% said they couldn't provide the kind of life that they would want for their baby. So we can see there is absolutely no separating the thinking about these abortion bans and restrictions and the economic impact that they're going to have, right? It's going to affect people's their livelihoods in so many different ways. And as we said, right, they're already coming into an environment where we are not giving families the supports that they need. So what do we do about it? Where do we go from here? It's like the connections are undeniable, right? So with abortion being banned, reinforcing Georgia's health and social safety net ecosystem has got to be a top priority. And 9 to 5 is working on a lot of these issues that could be a solution for families. So one of our campaigns that we're actively working on is around expanding access to paid medical and family leave. Currently, Georgia does not have a paid family medical leave program that supports all workers in our state. As I mentioned, in 2021, we helped to pass HB 146. Really good start, but again, it is only 3 weeks of paid parental leave. And it only applies for people who are state employees, public school employees, or employees of the university system of Georgia. So 43% of Black workers and 25% of Latino workers have access to any paid parental leave at all. And many people of color can't take advantage of the law that we do have across the country, the Family Medical Leave Act, right? Because it's unpaid. This low percentage of people of color who have access to paid parental leave really stems from occupational segregation, where women, and particularly women of color, are more likely to work in jobs that pay below a living wage and don't provide benefits. In Georgia, FMLA is inaccessible to 59% of all working adults, either because they're not eligible or because they can't afford to take the leave without pay. So this is a really critical issue that we are really pushing for. What we want is a comprehensive paid family and medical leave policy, right? I mean, supporting parenting folks is incredibly important, but supporting families and individuals to take care of their medical needs and take care of other folks that they're caretaking for in their families with their medical needs is also incredibly important as far as supporting those people's economic well-being. And so that is what we want, right? We want universal, comprehensive paid family and medical leave for all workers in Georgia. Right? So that we want that to include folks who are independent contractors. That would include people who are domestic workers. It needs to include people regardless of their immigration status. All folks who are working should have access to paid leave. So this is a bill that we worked on this past year, 15-17, that would actually create a paid leave insurance program in our state. And it is something that the employer and the employee would pay into. It's similar to like a workers' comp type of program where it would be there when you need it, right? And that all people would have access to it. This is a really critical issue. We actually just put out a report, a really detailed cost-benefit analysis of paid leave here in Georgia. We also highlight people's, Georgians' personal testimonies in this report of how not having paid leave has impacted them and their families. We do a comparison of where Georgia is in relation to other states that have paid leave policies, including other southern and peer states, which we know is important to our lawmakers. So we would definitely invite folks to download that. We are also 9 to 5 leads the Georgia Coalition for Paid Leave. And we are a group of about 20 organizations, advocacy organizations that are coming together to push for this policy. So not only are we pushing in the policy arena, but really also building power with workers on the ground. We're really excited that this fall we will be rolling out a fellowship program through the Paid Leave Coalition of, again, workers who've been directly impacted by not having paid leave. They will go through a leadership development training program, and then we'll be leading aspects of our campaign. So we're really excited to roll that out, and I will be inviting folks to join us in just a few minutes. Secondly, we have to figure out childcare. This is a huge need for Georgia families. The childcare infrastructure was already crumbling, and then COVID happened and magnified that crisis by 100-fold, right? And thinking about these abortion bans is going to increase the need of childcare in a system that is already pretty weak and really struggling. So this is another issue that we really have to make some progress on, and that 9 to 5 is putting a lot of energy towards. We know that we have some childcare subsidies; those have been extended as a result of COVID through 2024. But we know that we have to have some lasting, expansive policy shifts so that more people can access the things like CAPS, where right now in Georgia, only 1 in 7 children who would be income eligible for this childcare assistance can actually access those subsidies due to lots of, qualification barriers and things that are a part of that program. So that is also a really critical piece of this puzzle. Right now, 9 to 5's work around childcare is we're focusing on a local campaign out of Savannah. We're working with childcare center providers as well as friend and family caregivers, which a lot of people have always turned to. But certainly there has been a ramp up since COVID, right, of neighbors taking care of kids or other family members taking care of kids. And those people need supports as well. And so we are working with all of those providers to ensure that there are local solutions and support so that they can get the support that they need to be able to offer that care to families. Another really important solution that we have to think about is increasing protections against workplace discrimination and harassment. It's a really key way to help ensure that women can stay at work, right, and retain their economic security. Georgia is one of only 3 states across the country with no state-level law protecting private sector workers from discrimination and harassment at work. So what that means, since we don't have a state law, we're covered by the federal protections, right, like Title VII. But there's lots of issues with that, right? It leaves out far too many workers. It's way too narrow of a window of time to be able to have to report And the federal law really doesn't acknowledge the intersecting ways that workers experience discrimination. So we really need a more expansive definition that works here in Georgia and ensures that, again, all working Georgians are protected at work. So that has to include independent contractors, domestic workers, interns, third-party contractors have to be accountable to discrimination and harassment. It's also really important to employers, right, to have a really clear understanding of what unlawful discrimination is, so that they can help their employees stop and prevent harassment. So we know that often our Georgia legislators don't want to tell businesses what to do, but we really are working with businesses for them to be able to stand up and say, no, this is something that we want, and this should be something that is statewide. So 9 to 5 leads the the Respect Georgia Workers Alliance, another coalition of Georgia-based advocacy organizations working to ensure that workers are safe and respected on the job. We work closely with Representative Anulowicz, worked with her this past session to pass HB 1390, which was that retaliation protection law specific to sexual harassment for city and county workers. Of course, we also introduced something that was much more comprehensive and covered more workers. And we actually are really encouraged by the conversations that we had during this last legislative session. We feel like there's some real momentum to expand the protections that are available for workers in Georgia. We're also building a lot of community power around this issue. We just this year launched the Respect Georgia Workers Alliance Survivor Leadership Fellowship that supports and lifts up people directly impacted by workplace discrimination. Our first cohort just graduated, and these leaders went through a leadership development training series, and then led many of the actions and events that the Alliance did for this past year. 2 of our fellows shared their stories during a committee hearing. They led many events to work to connect with other workers who've been impacted by this issue. Did a lot of one-on-one story sharing, listening sessions, and different things to connect with more workers. So we're really looking forward to now these folks becoming leaders within the campaign, and also looking forward to welcoming a new cohort of leaders this fall. Another really critical aspect of thinking about workplace discrimination that is connected to these abortion bans is pregnancy discrimination. 9 to 5 used to host for many years a worker helpline where workers would call from across the country with issues that they were facing at work to get some non-legal advice, but advice from folks who've been doing this work for a very long time. And the majority of calls that we would get was issues related to pregnancy discrimination. It is incredibly common for pregnant workers to be forced to quit before they want to be moved into a different position that might pay differently, all types of issues related to pregnancy. So this is another incredibly important issue that we're going to have to find some solutions to. It including passing better legislation to protect more pregnant workers, and then also to expand the accommodations that pregnant workers are allowed to use when they're on the job. These types of accommodations can be really simple, like being able to keep a bottle of water with them, or have a stool to sit on when needed, when maybe that's not something that other workers would be able to do. But we know that these types of simple accommodations can really mean the difference between being able to stay at work and a person losing their jobs, right, and their economic security. So we're really proud to be a part of the Georgia Pregnant Worker coalition that Healthy Mothers, Healthy Babies leads, along with some other amazing partner allies. And we really encourage folks to get involved with that issue as well. Lastly, another issue that I want to raise up is pay equity. We have to address this issue of pay equity if we're going to make economic justice a reality for workers. So we know, right, that parents forced to bringing in more children into their families when they might not be ready are going to need more income, plain and simple. But we know that when women still face unequal pay to this day, and that inequity only grows, as you can see, when broken down by race, this is a really critical piece of the puzzle that we have to address. So we know that even in 2022, women on average earn roughly 82 cents for every dollar earned by their white male counterpart. And we know that wage gap affects all women, but grows even larger for women of color. So you can see by this graph how that breaks down. And then this next graph shows you how much money different women are losing over their 40-year career. So this is absolutely critical, right? So we have some solutions. 9 to 5 for the past several years has been working with lawmakers to introduce some pay equity legislation. Part of the bill includes some requirements around pay transparency, so that when someone is going to get a new job, they know the salary range of what that position could be, right? Because what we know is that if that isn't the case, then women of color are going into these interviews asking for a pay range that actually could be much less than what the company was prepared to offer, but they get stuck, right, with that lower wage. And so making that more transparent is a key solution to pay inequity. The second thing that the bill does is that it bans questions about previous salary history. Because, right, if someone was paid unfairly in their previous job and they're asked about their pay in this potential new job, and they get the same or maybe just a little bit of a bump from their last pay that was unfair, that only perpetuates the cycle, right? So other states have passed similar laws like this. We know that it makes a really big difference for workers. So that's another thing that we want to be pushing for. So just a few calls to action. We know that there is so much work to do to support our families. We know that even before these abortion bans, there were not enough supports for families, right? And now that need, again, is just going to be exacerbated. So we really have to do everything that we can to make sure that these social and economic safety nets are what our families need and deserve. So I will drop some of these links in the chat after I hand it back over to Allison Kaufman. But we would love for folks to take a pledge to vote. We know that voting is a critical way, one tool in the toolbox, right? But a really, really important one towards making sure that the folks that are being elected are coming from a place of our values and around these issues, right? We definitely want folks to join our paid leave campaign, our Respect Georgia Workers campaign, and we'd love to invite you all to become an official member of 9 to 5. Any donation that you would make towards 9 to 5, no matter the amount, would make you a member. So we would really ask that you all join us. We know that it's going to take all of us to pass the policy pieces that we're doing to reach the communities that we need to be reaching through our grassroots organizing. And so we would love for you all to join us. So thanks so much. I'm going to turn it over to you, Allison.
Thank you so much, Allison, for sharing all that like depth of information about the context here in Georgia, right? Like how people economically are being impacted by these issues here in Georgia, and making the very clear connection to abortion access and the implications that has for economic justice, and the way that economic inequity impacts abortion access. So it was really clear how these issues, as you said, cannot be separated. So I really appreciate you sharing that, and then all the inspiring work that 9 to 5 is doing. There are so many different ways that we can get plugged in, all kind of working together towards the same shared wins and goals that we have. So I'm going to take a little bit of time, probably like 5, maybe 10 minutes, and then we can save a little time for questions if anyone has any, to share a bit about mutual aid and some work that some other organizations are doing here in Georgia to support folks through mutual aid. So I'm going to share my screen. Maybe I want to present first. Sorry, y'all, bear with me. Okay, I'm going to share my screen. All right. Okay, so very brief intro to mutual aid. So what is mutual aid? Put simply, it's when people work together to meet needs, right? Many cultures, many especially indigenous cultures, have built-in practices of mutual aid. The one that I'm familiar with is from the Andean culture, the Quechuan culture of like Peru and Ecuador. My family, or half my family, is from Peru, and it's a system of aini, right? So it's a system of reciprocity where you support other people in your community, knowing that in the future when you need support, community members will be there for you. It is not transactional. I think sometimes, especially in the West or in American culture, it's like, oh, I'm trading, you know, like you give me this, you give me that. It's actually not about that. It's about showing up and supporting each other, knowing that in doing that, you too will receive similar support at some point in time, or your future generations of your family will. Charity is different. Charity is about helping others, right? It's very much an us-them dynamic. Most nonprofit models are based on a charity model, right? So it's like, I join a nonprofit, I work for a nonprofit, and I go out and I support or save other communities. Mutual aid is about helping each other. Sorry, y'all. Let me go back to present. And so I just really wanted to make that distinction because I feel that that's often where the white saviorism comes in to play, right? It's like this idea of the white nonprofits going out and saving communities of color, and mutual aid is not that. It is by communities for their own communities. So we were really excited to have Mama Fund here. It didn't work out, but I just wanted to give them a shout out anyways, because they're an amazing mutual aid group based here in Atlanta. The Mama Fund was created by community members back at the start. It sounds like so long ago, but I guess it was at the start of the COVID-19 pandemic. Basically, as a response to the fact that a lot of folks just needed material support immediately. And so they started a grant program where they raised money from community members and reallocated those resources to community members who needed it, with a focus on areas in Atlanta and a centering of the most vulnerable. So Black, Indigenous, and people of color. And they have been doing this through various rounds of donations and funding cycles. And you can support their work by giving either monetarily or through your time and other services. What I really appreciate about their work is like they're very intentional and why they're doing the work and the theory of change that they're bringing. So they have a reciprocal system. They talk about mutual aid as a reciprocal system where those that benefit are also feeding back into supporting others with either services, money, or other values, or other value-adding measures. And that the systems inform how we relate to each other in the community and support self-determination. So you can see that like the values and the how are as important as what they're doing, and as part of their model of kind of the world they're trying to create. And I also appreciate this because there's an expectation that or an acknowledgement that every single person has something to give. So whereas you may be receiving money, you can also be contributing other means of support. Also just naming that it's about wealth redistribution. It's shifting money away from those who have a lot of money to those who don't. And then building alternative systems. Since the creation of Mama's Fund, they recognized that the initial monetary support was essential, it was needed by community members, and that was not sufficient, right? That we needed larger scale systemic change and redistribution of wealth. And so that is something that's built into their model and part of like the next iteration of the work that they do. And so I will share the link to Mama Fund. If you're interested in learning more about them or supporting their work, I strongly encourage it. You can set up a monthly donation, which is what I did, so I never forget to support their work. I also wanted to share a little bit about Access Reproductive Care Southeast, another mutual aid organization, and Abortion Fund. I'm sure y'all have heard a lot about ARC. Oriaku, who was our plenary speaker this morning, is the former executive director and is a co-founder of ARC. So ARC is Georgia's only abortion fund. It provides funding and logistical support to ensure Southerners receive safe and compassionate reproductive care, including abortion care. They also do education and leadership development, and work to abolish stigma and restore dignity and justice for Georgians and Southerners more broadly. And I serve on the board of ARC Southeast, so I just think it's really important that we celebrate the work that they do and acknowledge it as one of mutual aid, because not only is it funded by grants, but also by community members who contribute to the work and then help run the organization. And just a little bit about who ARC Southeast reaches, because we're talking about, right, economic justice. And when we're talking about abortion funds, I often get questions from people like, well, do abortion funds actually reach those most in need of support? And I mean, the answer is, at least for ARC Southeast, that it does. ARC Southeast callers, 87% of the callers that call into ARC Southeast Healthline are uninsured or on Medicaid. Something really important to know about Georgia is that government-funded insurance is not permitted to cover abortion care. So poor people who are on Medicaid aren't able to use the insurance that they have to cover the abortion procedure, except in very limited circumstances. And the average cost of a first trimester abortion is around $560, which we know from many studies that like over half of Americans could not pay for an unexpected $500 cost. So that means that people without means, even if they have government funded insurance, are often unable to afford abortion care. And then once you start getting later in pregnancy, which often happens because people delay care due to economic barriers to accessing care, it becomes more and more expensive. And now with our early abortion ban, on top of having to try to afford the abortion procedure, people are having to try to find cover the cost of transportation, whether it be driving or flying, childcare, time off work, hotel costs when they're traveling to another city. And that just, again, like increases the economic barriers to many of the folks that ARC funds. 62% of their callers identify as religious. It has nothing to do with economic justice, but it's just a note about like debunking some of the narratives we have around like who accesses an abortion. 77% of ARC's callers are already parents. So again, we know how expensive parenting is. Allison just shared a lot about the many barriers that parents face, like in the workplace and in accessing childcare. We could talk about the formula shortages, right? And so these are parents who are trying to do the best they can to parent their existing children and are making the best decisions for themselves and for their families. And then 86% of ARC's callers are identify as people of color. So again, we're talking about the economic injustice in Georgia and how it disproportionately hits Black folks, brown folks, and other Indigenous people. And that we're seeing that borne out in the data of who needs to access an abortion fund when accessing abortion care. Because again, like the same people being impacted by these other injustices are impacted by barriers to abortion access. And so that's just a plug, a little overview of what ARC does, really trying to make sure that every Georgian is able to access abortion care, no matter their economic barriers. And then really importantly, kind of going back to what Mama Fund does, making sure that those folks who have accessed ARC's services, who have utilized abortion care, have the opportunity also to then be ambassadors for change within their communities, right? Get plugged into the work if they so desire, and try to make the change that would make it easier for future people to access abortion care, which is a new kind of scope of work that ARC is growing into, which is around power building, right? Because we know that that's ultimately how we're going to realize the changes we want to see in our communities. So I spoke somewhat quickly, I'm sure. But I just wanted to give that overview. I'm going to stop sharing. Actually, I'm going to share one more thing. Before we get into questions that anyone has, I just want to flag one more resource, because I think when we talk about economic justice, when we talk about class, it can be kind of hard for us. I would say, especially in the US, right? Because we don't like to talk about class in the US, to really know, like, to really interrogate the roots we come from, right? And the class privilege that we may be bringing to the work that we do. And so in part, and like parting, I would just like to share this resource with folks, encourage you to go online, explore it a little bit more. I know other organizations that have utilized this, like the Aorta Cooperative, to create sliding scales for their payments. But there is this resource generation resource. They also have a quiz, but it walks through kind of how you can unpack what class you are currently in and what class you grew up in, and have very detailed explanations of like signals, right, of which class you are likely a part of, and then share some basic data on each of the classes. But the reason why I'm sharing this too is because when we talk about wealth redistribution, when we talk about who is leading the work, it's also really important for us to understand who we are in the work and our relationship to economic justice and injustice, so that we can interrogate some of the assumptions we have, and also recognize the role we should be playing in this work, or the role that we should be doing to support other people to lead the work. So I'm going to stop there. I'll share this link in the chat.
I think I can speak for everyone just in saying, like, thank you so much to Allison Glass and Allison Kaufman. This has just been a huge wealth of information. And we have about 4 or 5 minutes left, so we haven't had any questions come in yet, but now's your chance, y'all, if you have any questions that you would like to ask the Allisons.
Questions or reflections. And if you want to come on and speak, just note that in the chat. It's great to see you again, Nandi. Right, I'm going to make sure to share that link as well. And this is ARC's website. We're involved. All right. If there are no questions, then I feel like we can conclude and give people 3 minutes to take a bit of a pause between your next sessions.
That sounds great. Well, thank you both so much. This was just really super informative and just so important. So thank y'all.
Thank you.
Awesome. Thanks so much for having me, y'all.
Bye.
Take care.